So now we will be doing few minute discussion of the previous class, whatever we discussed. Then we'll go to the deeper understanding of the brain, blood supply of the brain, nerve supply of the brain, and the problem happening because of the compression of the nerve, problem happening in the brain due to bleeding, and there are many other problems or the neurological problems happening because of the various structures of the brain. So first, what we have discussed in the previous class about the bones in the brain. So this is the frontal bone, which is in the front side. Now, if we are going on the back side of the frontal bone, this is the right and the left parietal bone. So the frontal bone is only one, but the parietal bone is on the right side and the left side. So there are two parietal bones. They are in the pair. Then we are coming on the side, just above the ear. So our ear is here, ear is here, and this is the temporal bone. So we are having right temporal bone, left temporal bone. There are two temporal bone. So the temporal bone is also in the pair. Then we are going on the back side, that is the occipital bone. This is single bone. So this is a bun bone and is a single bone. Then other than that, there is very important bone here. That is sphenoid bone, which is inside. So we can see here, this is the sphenoid bone, which is inside from right to left. If you see entire head, it is like that. But the bun bone inside hidden, that is a very important bone, which is from the right to left, which is sphenoid bone. So this is a very important bone, and there are many other bone other than this. Okay. Why these bony structures? Not only this, there are too many bones on the face. We can see this is the maxilla bone. We are having upper teeth on the maxilla bone here. So right and left maxilla. The mandible. Mandible is a single bone. Jaw, the mandible, where we are having lower teeth. So in this way, there are too many bones, right? There are total 14 bones on the face. So we have discussed already. Why these bony structures are present? What is the reason for these bony structures? Because they are protecting our brain. This is the brain, which is the very important structures of the human body. So we are looking the brain from the front side. So this is the front side. And if we turn, then we will be going on the back side. So we can see this is the back side, and we can see this is the small brain or the cerebellum, which is on the back side. So we can see this is the cerebellum just above the neck, or we are telling small brain, or it is also called a reptile brain. It is very important for balance and coordination. So we know how the monkey is making better balance than the human. Monkey can make very better balance. There are many other animals. They are having more developed this brain, cerebellum, they can balance. Even the human who is having good cerebellum, and they are by the practice they are activating cerebellum, they are having better balance than the other, right? If the cerebellum is disturbed, then person will not be able to balance and person will walk like a drunkard. आपने शराब पीने वाले को वॉक करते हुए देखा होगा. The person who is drinking, how is walking? Cerebellar dysfunctions. That is called. So if the person is having The disturbed cerebellum, so that is called cerebellar ataxia, right? Person is walking like unsteady walk. You know that. How the drinkers walking. शराबी कैसे जो चलता है. It is due to the cerebellum. So we have to protect the cerebellum because cerebellum is very important part. If there is any injury to the cerebellum, then person will lose balance. Now, this is the small brain and this is the bigger brain. We can see this entire brain. This is called cerebrum. This entire remaining part, this is called cerebrum or the master brain. This is the brain responsible for intelligence, thinking, math skill, and many other skills, the skills of speech and all, learning ability. So this is called the brain who provide you intelligence and learning capability. And this is the brain that is the cerebellum, which is connected with the balance and the coordination. So in this way, brain is very much important. So to protect the brain, we are having outer protection, that is bones, like we have seen previously. Now, brain, how they look like? Brain. If you see the brain, it's look like walnut. Okay. So we can see there's a frontal part. Even the frontal part is having multiple divisions like this, the frontal part. Okay. This is also the frontal part. This is also the frontal part. So we can see these are temporal part, temporal part, temporal part. It's written temporal part, right? On the back side, we are having this occipital part. In this way, there are different parts of the brain. These elevation, we can see here, these are called gyrus. Gyrus. And in between, we are having the depression. They called sulcus. Sulcus. So brain is having multiple gyrus and sulcus. So what is the benefit of the gyrus and sulcus? So brain is like that. It is improving the surface area. Surface area. Like there is a bigger bed sheet, but we can fold and we can make this much. In the same way, there is bigger brain, but we are folding, folding, folding. So we are making very compact and we are keeping it has been kept here. So gyrus and sulcus for making the brain more compact, and brain is a very big but coming in the small area. So now there are many other part of the brain. So I told you about the cerebrum. So cerebrum, cerebellum, there are many other part of the brain. So what is the division? What is the classification of brain? I will give you quick summary. So let's see now. So we can see here, brain we can divide mainly, we can divide the brain in three parts. Okay. So we can divide the brain mainly in three parts. Entire brain. So the part number one, part number two, and the part number three. So we can consider the part number one, the part number two, and the part number three. One, two, and three. So we are telling it forebrain. Then we can tell it midbrain. and we can tell it hindbrain. यानी आगे का ब्रेन, यानी फोर मीन्स आगे का ब्रेन, मिड मीन्स बीच का ब्रेन, हाइंड मीन्स पीछे का ब्रेन. Okay. So the forebrain is the largest, we can see in this image. It is the largest. Okay. Now just I told you the hindbrain is means cerebellum. So let's see here. Just I told you this is the hindbrain cerebellum responsible for balance and coordination. Okay. And this is the forebrain, and the brain who is in between these two, that is called midbrain. Midbrain का मतलब क्या है? जो forebrain को हाइंड ब्रेन से कनेक्ट करे उसे कहते हैं मिड ब्रेन. ओके, इट्स लाइक ए कनेक्शंस, कनेक्टिविटी, जो लाइक ए ब्रिज. सो जैसे एक ट्रेन है, मेट्रो ट्रेन है. सो हियर मेट्रो ट्रेन इज गोइंग, हियर देयर इज ए बस is going. So there are one bridge who is connecting this metro train with this bus stand in between the road. So that is mid brain. On the one side, we are having forebrain, then the midbrain, then the hindbrain. Every part of the brain is having very much importance. हमारे प्रत्येक ब्रेन के पार्ट का बहुत ही महत्वपूर्ण इम्बैलेंस, बहुत ही महत्वपूर्ण. फॉर एग्जाम्पल, इफ द पर्सन इज हैविंग सम इंजरी, किसी ने डंडा मारा, धड़ाक 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 धड़ाक, दर्द हो रहा है, दर्द हो रहा है, दर्द हो रहा है, फोर ब्रेन इज फीलिंग इट. फोर ब्रेन. ब्रेकअप हो गया, ब्रेकअप हो जाता है, लड़की ने धोखा दिया, लड़की ने धोखा दिया, या किसी ने, दर्द हो रहा है, अंदर दर्द हो रहा है, द पर्सन इज फीलिंग पेन इनसाइड. That is also felt in the forebrain. So forebrain is connected with the physical feeling, like whether the sensory feeling, pain feeling, motor feeling, even the emotional, both connected with the forebrain. जैसे किसी ने डंडा मारा, धड़ा और दर्द हो रहा है, छोड़ दो, that is thalamus who is feeling. Now emotion are giving you pain after the breakup, that is hypothalamus giving you pain. Okay, so every part of the brain is having different condition. So this brain is giving you number one, pain signal and all. Hypothalamus is also connected with many other things I will discuss with you. If you are telling, oh, you are very intelligent, your memory is very good, you are praising the forebrain. Forebrain means memory. That person is very much intelligent. Memory is super. Okay. Oh, his thinking process is very fast. His maths is very, very good. You are praising forebrain. So forebrain is responsible for too many things. Okay, forebrain. Forebrain also storing the emotions during the pregnancy. Suppose some mother is having trauma during pregnancy, or maybe some fight, some quarreling happening during her pregnancy of the 9 month. So child forebrain will be receiving all these memory. Then after getting the birth, even till the 6-7 years, all the memory he is storing in the forebrain. So the entire personality, entire life, the coming life will be in the coming life, that thing are reflecting. For example, एक बच्चे को खूब डराया जाएगा, धमकाया जाएगा जब वो 6-7 साल का होगा, तब तक मीन्स 0 to 7 years सारा फोरब्रेन में इकट्ठा हो जाएगा. फिर बड़ा हो गया, आईएएस बन गया, आईपीएस बन गया, कोई बिजनेसमैन बन गया, कोई बड़ा अधिकारी बन गया, but somewhere inside he is having fear. In the difficult situation of the life, he will break down. So forebrain is very much important. So I will write here, forebrain is connected with the mainly four things. So this is the forebrain. The forebrain is connected. This biggest part, which you can see, this entire biggest part is सेरिब्रम, जो आपको दिख रहा है ना, पूरा पूरा ये पूरा सेरिब्रम है। ये पूरा जो अखरोट जैसा दिख रहा है, दिस एंटायर, दिस इज सेरिब्रम। ओके यार, हिज मेमोरी इज सुपर। Oh, his thinking process is very fast. He give answer very fast. He is replying very quickly. So this is cerebrum. Okay. So the part of the forebrain. Then we are going a little inside. If we remove this forebrain, चलिए इसे थोड़ा सा हटाते हैं। I am removing the forebrain. So we can go inside. देखिए, अभी आधा हटाया है इधर का, इतना निकल गया, इसे भी निकल। So now we can see we have removed the cerebrum. ये जो निकाल दिया ना ऊपर का, ये सेरिब्रम था, ये भी सेरिब्रम, इसे भी निकाल दो, ये सब सेरिब्रम। सेरिब्रम हमने निकाल, एक तरफ का निकाल दिया। नाउ now we reached after the cerebrum. Now we can see this is the structure which is called thalamus. This is also the part of the brain or the forebrain. Thalamus. Thalamus is receiving the pain signal. So just I told you someone is beating someone, so the person is feeling by the thalamus. So thalamus is feeling the senses, or even it's connected with the motor action. That is also the part of the forebrain. It's connected with the sensory and the motor signal. अगर किसी का थैलेमस डैमेज हो जाए, ये एक्सपेरिमेंट किया गया था, या अपने आप हो गया, किसी का थैलेमस थोड़ा सा इंजर्ड हो जाए, उसे दर्द नहीं होता, फिर कहता है मर्द को दर्द नहीं होता, वो मर्द बन जाता है, चाहे लेडी हो चाहे जेंट। ऐसे these experiment has been done during some there, so actually there are some criminals, they are doing lots of crime, then after getting arrested, even they are getting too much punishment, but they are still laughing. जैसे कैसे वो पुष्पा मूवी में कैसे हंसता है ना, उसे मारते हैं और वो कहता है, वो बीड़ी पीता रहता है, उसे कोई फर्क नहीं पड़ता। So the thalamus is like that, person is not getting pain. So that's why in the battlefield acupuncture, in our auricular acupuncture, there are 5 points and one is thalamus. You see, there are 5 points. One is thalamus. We put the 5 points and the pain goes away. Lower back pain, knee pain, neck pain, headache, whatever the pain, if you do the battlefield acupuncture, pain will go away. So thalamus point has been taken just because of this reason. So thalamus is giving you pain signal. But if thalamus injured due to some reason or impaired, then person is not getting these sensory signals. So thalamus is connected with the motor and sensory signals. Now let's see here again. So this is a thalamus. So let's see, this is the thalamus. Now below the thalamus, now we are looking from the side. So we can see the thalamus, and below the thalamus, this is a hypothalamus. Hypo means below. So this is the thalamus and this is the hypothalamus. Hypothalamus connect with the emotions. It's a very important. So this is the thalamus and this one is the hypothalamus. It is connected with the emotions. So the person is having lots of problem nowadays because of the hypothalamus. Nowadays, people are suffering with lots of problem with the hypothalamus because as soon as they are getting some emotional imbalance, hypothalamus is getting disturbed. And hypothalamus controlling your pituitary gland. Why the hypothalamus controlling the pituitary gland? You can see in this image only. So let's see the image. Again, you can see this is the, we are looking from the front side. Okay. So now, if you see your neck is here. The neck is starting from here. Okay. Try to imagine a little bit, but don't worry. We will be discussing the functions. So if this is the hypothalamus, so hypothalamus is making something, then with this pipeline, this is coming in the pituitary gland. This is the pituitary gland. So this is the hypothalamus, then with the duct, with the infundibulum, the secretion are coming in the pituitary gland. So hypothalamus is getting disturbed, then pituitary gland get disturbed, and we know the pituitary gland is the gland which is called master gland for hormones. That's why if the forebrain is disturbed, if the hypothalamus is disturbed, then person is getting lots of hormonal problems, irregular hormones, and we know hormone problems means the problem of menstruation, the problem of thyroid, problem of pancreas. There are lots of endocrine glands in the human body. They are secreting hormones, but all controlled by supermaster, that is hypothalamus. Hypothalamus also control two more things. Number one, body temperature. So hypothalamus giving command to thyroid gland, and thyroid gland increase the body temperature or decrease the body. Thyroid gland is very much important gland for maintaining the body temperature. So hypothalamus is maintaining body temperature. Suppose someone is having very high fever, you can treat hypothalamus. Suppose someone is having cold body, you can treat the hypothalamus. So one thing, hypothalamus controlling temperature. To second thing, hypothalamus controlling swelling or the water metabolism or the water circulation. Someone is having some swelling somewhere, so we need to work on the hypothalamus. So in this way, emotions, temperature, and water metabolism. So now we can understand the forebrain is super important. Forebrain, right? One. Now let's see here. So this is the thalamus, hypothalamus, and the pituitary gland. Let's remove the thalamus. Remove thalamus. Remove the hypothalamus. Remove the hypothalamus. How the brain look like? Let's see. Okay. So we can see the midbrain will start now. So we remove this, then the midbrain will start. Okay, so there are mainly four parts. Number one, cerebrum, bigger brain. Number two, thalamus, pain signal. Number three, hypothalamus, temperature, hormones, swelling. And number four, emotion, because it's controlling the emotional brain. So in the other language, emotional brain is called limbic system. Okay, limbic system. So whenever you want to treat the some person is telling you, now patient will be coming to you. Oh, he's not able to understand calculation or the math. Which part you will treat? Tell me. Thalamus, hypothalamus, or cerebrum? Person is not having math skill. Math skill. Which part you are going to treat? कि मैथ की स्किल नहीं है. बोलिए. मैथ को कौन कंट्रोल करेगा? थैलेमस, हाइपोथैलेमस या फिर सेरेब्रम? मैथ, cerebrum. Perfect. Cerebrum is connected to reasoning, thinking, logical thinking, math skill, cerebrum. Okay. Who is receiving emotional pain? Emotional pain कौन बताता है? Hypothalamus. Who is the controlling all the hormones? The female is suffering some hormonal menstrual problem. You will work on the hypothalamus. Who is controlling your pain signals, like motor signals, sensory signals? And the one more part, that is limbic system or the limbic brain. So actually everything will be written in the PDF. That's why I'm just speaking. I will be giving a PDF. Okay, fine. So we have divided the brain in three parts: forebrain, midbrain, hindbrain. Then forebrain we have divided cerebrum, thalamus, hypothalamus, and limbic brain, limbic system. So when anyone is coming with some problem, you should know which one to treat. So hypothalamus is connected with the emotions, temperature, water metabolism and swelling, even hormones, and one more thing that is called hunger. Okay. And limbic system is connected with the emotions. Cerebrum is connected with thinking, memory, reasoning, learning, math skill. Okay. Cerebrum. Now, because why I'm telling you, because patients are coming like that. The disease acalculia person is not able to do calculation. The name of disease acalculia. Okay. The disease is, there are many person having memory issues, forgetfulness, learning. Okay, many, we know we are not talking about if you tell, oh, I'm not able to learn, I forget. No, you are normal. We cannot count any one of you or me like we are having good brain. Okay. I'm telling about the many kids, they cannot memorize anything. Coming near the mental retardation. Okay. They cannot memorize anything. Now, very important. You know, you sleep by 10 o'clock, by 11 o'clock, by 12 o'clock, sometime 10:30, sometime 11:30, sometime 12:30, sometime here and there. But most of the time we get up on the same time. Okay. Maybe if there are too much shifting, then even we will not get up in the morning. Someone is getting sleep by the 11 o'clock in the night. Some other person is getting by 12:30. Some other person is getting by 10 o'clock. Every person is having different sleep wake cycle, which is controlled by pineal gland. Pineal gland secrete one hormone that is called melatonin, and the pineal gland secrete this hormone, and person is getting very deeper sleep, and pineal gland is controlling the sleep wake cycle. If the pineal gland is disturbed, then the sleep wake cycle get disturbed, then person will not get sleep or will not get, maybe frequently waking up, something will get disturbed. If the person is sleeping on the right time, waking up on the right time, getting a very sound and good sleep, it means your pineal gland working very nicely and secreting good amount of melatonin. What are the factors who is disturbing the pineal gland? Number one, light. So we should sleep in the dark room. Okay, when you are sleeping, switch off the light. Number two, mobile and the laptop screen, which is called blue screen. So when you are going to sleep, before 1 hour, put away all the device. And other factor are stress. So now this pineal gland is located in the midbrain. So let's see now. Midbrain is the relay station. So look at in this image now. So this is the forebrain. This entire brain we have seen, this is the forebrain. After the forebrain junction, at the junction we can see the small gland, very very small gland, that is pineal gland. The pineal gland. The pineal gland secreting melatonin hormone. This is the pineal. Okay. And this is coming in the midbrain. So not only this, so what are the structures coming in the midbrain? मिड ब्रेन में कौन से स्ट्रक्चर्स आते हैं? मिड ब्रेन का मतलब है कि जो फोर ब्रेन को हाइंड ब्रेन से जोड़े, उसे कहते हैं मिड ब्रेन. तो ये बीच के जितने भी छोटे छोटे भाग दिख रहे हैं ना, ये सब राउंड राउंड, ये सब मिड ब्रेन में, ये से ऐसे गोले, उनको बोलते हैं कॉलिकुलाई एंड ऑल, वो मिड ब्रेन में आते हैं. ठीक है, अब ये मिड ब्रेन के बारे में और ज्यादा बात नहीं करेंगे. नाउ वी विल बी कमिंग टू द हाइंड ब्रेन. हाइंड ब्रेन इज वेरी इंपॉर्टेंट पार्ट. द फर्स्ट थिंग कमिंग दैट इज सेरिबेलम. हाइंड ब्रेन में जो पहली चीज आती है उसका नाम है सेरिबेलम, विच इज कनेक्टेड विद बैलेंस, कोऑर्डिनेशन एंड फाइन बैलेंस, फाइन वर्क. आपको जैसे एक सुई लो, उसमें धागा डालो, डाल सकते हो ना. अगर आंखें सही है, चश्मा लगाए या चश्मा नहीं है तो आराम से डाल सकते हो. मतलब बैलेंस तो है ना कम से कम. लेकिन सेरिबेलम गड़बड़ हो गया तो सुई में धागा नहीं डाल सकते आप. ये वही बात होगी, एक व्यक्ति को खूब दबा के शराब पिला दो अच्छी तरह से, और उसको बोलो सुई में धागा डाल, कैसे डालेगा? ऐसे ऐसे करेगा वो। So cerebellum is connected with the fine motor control. Fine motor control. एकदम fine. Definitely coordination and balance. Someone is performing dance. In the dance, the person need very wonderful coordination. That is due to the cerebellum. Okay. If the person drinking alcohol, it's affect the cerebellum. So person is not able to balance. That is called cerebellar ataxia. Okay. Now many patients will be coming to you with a complaint of cerebral ataxia, and we have to treat with the cranial osteopathy. Without drinking also their movement is like a drinkers. Okay. So the first part, that is cerebellum. So let's see two more part in the hindbrain, second part and the third part. Let's see now. So this is the cerebellum. Now if you see the in, because we are looking the brain from the front side, now we are turning and looking the brain from the back side, we can see the cerebellum. सेरिबेलम कहाँ होता है? एक जो हमारा, जहां पर ये खोपड़ी खत्म होता है पीछे, हाथ रखिए, इसे घुमाइए, गो इन द हेयर लाइन, बैक हेयर लाइन, फील द डिप्रेशन, कैन यू फील द डिप्रेशन? वहां पर एक लंबी निडल डाल दो, कितनी लंबी? 2 इंच लंबी निडल डाल दो, तो पहुंच जाएगी मेडुला पर। कहाँ पहुंचेगी? मेडुला तक। डाल के देखना नहीं है, आपको समझने के लिए बता रहा हूँ, क्योंकि मेडुला में निडल डाल दी ना, पर्सन ऑन द स्पॉट, बिकॉज मेडुला इज कंट्रोलिंग two things: breathing and beating. Breathing from the lungs, beating from the heart, controlled by medulla oblongata. तो ऐसे उंगली करो, ऐसे, और तेज मार दो। कहां पर? ड्यू 16 पर। वहीं व्यक्ति गिर जाएगा। ऐसा मैंने पढ़ा है मर्म शास्त्र में, कभी ट्राई नहीं किया इसको, बट इन द मर्म शास्त्र इट इज रिटन दैट when the people used to do marma kalai, they were hitting this point, that is ड्यू 16, exactly where we are having depression on the backside, because we are in the connection of the medulla oblongata. अब उसके ऊपर का जो पार्ट है ना, ये सेरिबेलम है, दिस द सेरिबेलम। उसके ऊपर का पार्ट सेरिबेलम इज कनेक्ट विद द, यानी ऑक्सीपुट जो बोन है उसके अंदर ही है वो सेरिबेलम, कनेक्टेड विद द बैलेंस, कोऑर्डिनेशन एंड फाइन मोटर मूवमेंट। अब देखिए इमेज में, देखिए, चलिए लेट्स सी हियर। सो 3 पार्ट इन द हाइंड ब्रेन, द cerebellum. Now, in front of the cerebellum, there is a pons and medulla. There are 3 parts. So, this is the cerebellum, pons, medulla. Medulla is controlling beating and breathing, heartbeat and breathe. Regarding the pons also control breathing. Okay, this pons also control breathing. Okay, so pons is having some control on breathing and some more functions of the pons also there. It also regulates sleep. So the functions of pons are like this. Pons. So only 3 parts: pons, medulla oblongata, cerebellum. बेलम। ओके। अब ये जो नीचे का ब्रेन है, द हाइंड ब्रेन। ये हाइंड ब्रेन है। इन द हाइंड ब्रेन वी हैव स्ट्रक्चर पोन्स, मेडुला ऑब्लोंगेटा, एमओ एंड सेरिबेलम। एंड दिस इज द फोर ब्रेन। ये फोर ब्रेन है। और इनके बीच में जो है वो है मिड ब्रेन, जहां पर हमारी पीनियल ग्लैंड भी है, मिड ब्रेन। और भी कई छोटे छोटे स्ट्रक्चर्स हैं। मिड ब्रेन इज आई कि ब्रिज और द रिले स्टेशन। अब इसके बाद बारी आती है। अब इसके बाद ये तो हम सिर्फ ब्रेन के कुछ पार्ट समझ रहे हैं, अभी हमने सिर्फ ब्रेन को तीन भागों में बांटा है। अब हम बात करते हैं थोड़ी बहुत ब्लड सप्लाई की। अगर आपको एनाटॉमी क्लियर है, आप बहुत कुछ कर सकते हैं, क्योंकि पेशेंट आता है कंप्लेंट लेके, अरे पैरालिसिस हो गया, अरे राइट आंख से दिखना बंद हो गया, द पर्सन इज नॉट एबल टू सी फ्रॉम द राइट आई, पर्सन इज गेटिंग गॉट पैरालिसिस, or some neurological problems, some numbness in the arm, numbness in the legs, tingling sensation on the face, facial paralysis. Then in the report, something written, okay, cerebellar hematoma or this and that. You should understand what is the meaning of this. तभी तो आप ट्रीटमेंट कर सकोगे. So accordingly, you can choose the points. So now we will be seeing blood supply. So we know who is pumping the blood. हमारे शरीर में ब्लड को पंप कौन करता है? So now look at here, this is the heart. The heart is pumping the blood. Okay. Here we can see that the blue. Blue means the blood is coming to the heart for purification. Red means the pure blood is going in the body. जो शुद्ध ब्लड है शरीर में वापस जा रहा है. So the blue means impure blood is coming to the heart. And red means now blood is purified and going back in the human body. So when heart is pumping the blood, so with the help of this bigger artery that is called aorta, it's going in the body. So we can see this is the, ये जो देख रहे हैं ये मोटा, इसे कहते हैं लेफ्ट वेंट्रिकल. ये ब्लड को पंप करेगा अभी. So the heart is pumping the blood, and with this bigger artery that is called aorta. एओर्टा मतलब बहुत मोटी आर्टरी. उससे बॉडी पंप होगा. जैसे हमारे घरों में पानी आता है, तो हमारे घर में जो छोटी छोटी पाइपलाइन होती है, क्या पानी चलता है वहां भी छोटी छोटी पाइपलाइन से चलता है क्या? नहीं. फ्रॉम द ओरिजिनल सोर्स देयर आर बिगर बिगर पाइपलाइंस. Then they are becoming smaller, smaller, smaller. In the same way, heart is pumping the blood in the bigger artery that is called aorta. तो ऐसे निकलता है aorta. देखिए, heart has pumped the blood, then it's बड़ा, so it's going like this. So this is called arch because it's making the arch of aorta. Now from here, blood is going here as well as here, up as well as down. क्योंकि हार्ट को ब्रेन को भी ब्लड भेजना है, बॉडी में भी ब्लड भेजना है, दोनों तरफ हार्ट को ब्लड भेजना है. So now you have to focus only on the upper side. बॉडी को अभी हम फोकस नहीं करेंगे, हम केवल ऊपर की तरफ फोकस करेंगे। हमें तीन वेसल पे फोकस करना है जो एओर्टा से निकलेंगी सिर की तरफ। थ्री वेसल्स। ओके, लेट्स सी नाउ। ये मोटा है एओर्टा। Now pumping the blood and with a great force, the blood is going in these three vessels. Vessel number one, vessel number two, and vessel number three. Okay. One, two, and three. Okay. इनके नाम याद रख लो तो अच्छी बात है। This is the first vessel who is taking the blood to the right side, and these two remaining vessels are taking the blood to the left side. तो हार्ट ने जो ब्लड पंप किया वो देखो कैसे गया। हार्ट ने में से तीन वेसल निकली, एक मोटी वाली वेसल गई राइट को और दो निकल गई लेफ्ट को। अब ये तीन वेसल जाएंगी ऊपर, पूरी ब्लड सप्लाई इन्हीं से होगी। इफ देयर इज एनी हिंड्रेंस हियर, एनी हिंड्रेंस हैपनिंग इन द रूट, देयर इज ए प्रॉब्लम। एक सिंपल सी बात है कि ब्रेन प्रॉब्लम का मतलब क्या है, अब रास्ते में कहीं भी कचरा आ जाए बस उसे साफ करना है। यू हैव टू क्लीन द अनवांटेड blockage, toxins, deposition. These three vessels should be open. So in the cranial osteopathy we are doing lots of movement and okay, now work on this jugular. Now work on this, work on this, work on this. There is a different hold, different movements, and we can. So number one, we have to think for three vessels only. One is going on the right, two is going on the left. Yes. अब इनके नाम याद रख लेते हैं। रख लो तो अच्छी बात है, नहीं रखो तो कोई बात नहीं, लेकिन याद रखिए कि तीन वेसल जाती हैं। चलिए मैं आपको फिर से तीन वेसल के नाम बताता हूं। द वेसल नंबर वन गोइंग, सी because heart is in the left side, you can see. So from the aorta, the first vessel is going to the right side. Brachio cephalic, ट्रंक। ट्रंक का मतलब होता है मोटी वाली, ये भी थोड़ी मोटी, इतनी पतली नहीं है, अभी अभी निकली है। द मीनिंग ऑफ ब्रेकियो हु इज गोइंग इन द आर्म, द मीनिंग ऑफ cephalic हु इज गोइंग इन द हेड। सो द ब्रेकियोसेफेलिक ट्रंक जो राइट साइड के हेड में भी जाएगा और राइट साइड के आर्म में भी जाएगा। इसी को दबा दो, इसी को दबा दो तो राइट साइड हाथ खराब हो जाएगा, राइट साइड के ब्रेन की ब्लड सप्लाई खत्म हो जाएगी। सो व्हाट विल हैपन if there is any problem with the brachiocephalic trunk, there is a blockage, what will happen? क्या होगा सोचिए, ये राइट साइड को सप्लाई कर रहा है, अगर इसमें कचरा जम गया, if there is any blockage happening here, what will happen? लेफ्ट साइड में कुछ नहीं होगा, ब्रेन में, मतलब हम ब्रेन की बात कर रहे हैं। So if there is any problem in the right side, so there is a problem in the right upper limb or right head or right brain, the problem will be in the only the right side. हो सकता है ब्रेन, जब भी हम whenever we are talking about the brain related disorders, we have to start from here only. ब्रेन रिलेटेड डिसऑर्डर्स स्टार्ट फ्रॉम दिस पॉइंट ओनली। सपोज एक बच्चे का डिलीवरी हो रहा है और डिलीवरी के समय उसे यहाँ चोट लग गई, है ना, तो लो तभी से उसका पूरा दब गई, कंप्रेस हो गई, है ना। या कभी खेलते खेलते गाड़ी से जा रहे थे, कार चला रहे थे, खड़ा एक्सीडेंट हुआ और यहाँ यहाँ ट्रॉमा लगा, यहाँ ट्रॉमा लगा, या कैसे भी ट्रॉमा कहीं से भी किसी तरह से लग गया। इफ देयर इज ए प्रॉब्लम इन द राइट ब्रेकियोसेफेलिक ट्रंक, क्या होगा? जो कुछ भी होगा राइट साइड में होगा। इवन स्ट्रोक भी हो सकता है, डिजीनेस, कंफ्यूजन, वीकनेस, ब्लॉक, ब्लरी विजन, कुछ भी हो सकता है। द प्रॉब्लम इन द राइट आर्म, बोलेगा मेरा ये राइट आर्म ठंडा ही रहता है हमेशा। अच्छा, राइट ब्रेकियोसेफेलिक ट्रंक में तो प्रॉब्लम नहीं है, यहां से सोचना पड़ेगा आपको। अब इसमें भी हो सकती है प्रॉब्लम, या फिर आगे के पार्ट में भी हो सकती है, यानी हो सकता है इसमें कोई प्रॉब्लम ना हो, अब इसके आगे की जो ब्रांच है उसमें प्रॉब्लम हो सकता है किसी का राइट आर्म नीला पड़ जाए। सो दिस इज बिकॉज ऑफ द राइट ब्रेकियोसेफेलिक ट्रंक। ओके, नाउ लेट्स मूव टू द अदर जो बच गई। So now this is the right brachiocephalic trunk who is going on the right side. Now let's talk about the left side. अब हम लेफ्ट की बात करते हैं। लेफ्ट में ये दो हैं। नंबर वन, कॉमन कैरोटिड आर्टरी, नंबर टू, subclavian artery. What will happen if there is any problem in the common carotid artery or the subclavian artery? What is the function of these two arteries? Where they go? अब देखिए, ये कॉमन कैरोटिड आर्टरी सीधा ब्रेन में जा रही है। कॉमन कैरोटिड आर्टरी गोइंग ऑन द लेफ्ट साइड ऑफ द ब्रेन, सप्लाई द ब्रेन, नेक एंड ब्रेन, गर्दन से होती हुई ब्रेन में जा रही है। इफ देयर इज एनी प्रॉब्लम इन द कॉमन कैरोटिड आर्टरी, अगर इसमें कोई प्रॉब्लम होगी तो देयर विल बी प्रॉब्लम इन द नेक एंड ब्रेन। So this is a common carotid artery. So left side में left common carotid artery, common carotid artery, और ये जो दूसरी वाली है सब लेफ्ट सबक्लेवियन आर्टरी। इफ देयर इज एनी प्रॉब्लम इन द लेफ्ट कॉमन कैरोटिड आर्टरी, भैया इसे तो सीधे ब्रेन को ही जा रही है तो ब्रेन में प्रॉब्लम हो जाएगी। देयर विल बी सम प्रॉब्लम इन द ब्रेन, कुछ भी हो सकता है। और मैं इसलिए बोल रहा हूं कि कई बार इसमें ब्लॉकेज होता है। Many times people are having blockage in this. Headache, neck pain, so symptoms of stroke, memory loss. Many times we see there is a problem in the carotid artery. और या फिर सब क्लेवियन, सब क्लेवियन के नाम से स्पष्ट है ये क्लेविकल है, उसके नीचे यानी सब क्लेवियन। So the problem in the arm, shoulder, or somewhere. And even the brain, subclavian also connected to the brain. I will tell you how it is coming. तो तीन हमने आज समझी आर्टरी। कल के क्लास के लिए ये तीन आर्टरी के नाम याद रखने ही पड़ेंगे, नहीं तो आगे की बताऊंगा। जैसे अभी हमने क्या किया कि नदी के पास खड़े हैं, नदी के पास से मोटे मोटे हमने तीन पाइपलाइन निकाले। अब आगे जाके छोटे छोटे पाइपलाइन निकालेंगे, तो मोटे भूल गए तो छोटे समझ में नहीं आएंगे। तो तीन मोटे मोटे याद रखने पड़ेंगे। ऑन द राइट साइड बिगर ब्रेकियोसेफेलिक ट्रंक, ऑन द लेफ्ट साइड टू सबक्लेवियन, क्लेविकल के पास से, इसलिए सबक्लेवियन, कॉमन कैरोटिड सीधे ब्रेन में। कॉमन कैरोटिड वेरी इंपॉर्टेंट, ईच एंड एवरीथिंग वेरी इंपॉर्टेंट, तो याद रखना है ना पूरा का पूरा। तो अभी ओके, सो हाउ मेनी आर्टरी इन द राइट साइड? Starting from aorta, one. How many arteries starting from the aorta to the left side? Two. Yes, very good. Yes, तो enough for today. Now we'll continue discussion tomorrow. इसी के आगे की कहानी कल करेंगे. कल पहले मैं तीनों आर्टरी के नाम पूछूंगा आप सभी से, है ना, और सभी को लिखना है चैट बॉक्स में कल, है ना. इतना आई विल एक्सपेक्ट, सो आई कैन प्रोसीड अहेड. सो राइट नाउ वी आर अंडरस्टैंडिंग द एनाटॉमी. क्योंकि मैं आपको ट्रीटमेंट बताऊं उसके पहले एनाटॉमी तो पता होना चाहिए, है ना. अगर अगर मैं आपको बताऊं कि चलो हम सेरिब्रल एटेक्सिया का ट्रीटमेंट करते हैं, आप बोलोगे व्हाट इज सेरिब्रल एटेक्सिया. चलो एक काम करो, इसका वीनस साइनस का ट्रीटमेंट करो. ये क्या होता है? फर्स्ट यू अंडरस्टैंड व्हाट आई एम टॉकिंग अबाउट. ओके, इसलिए पहले एनाटॉमी, फिर हम बात करेंगे ट्रीटमेंट की. ओके फाइन. सो लेट्स क्लोज द सेशन नाउ. सी यू टुमारो. गुड नाइट.